This is like a circuit breaker. It will help to reduce the risk.
Masks are not something that you can wear and automatically get protected.
The transition from DORSCON yellow to orange, we expect that this is likely to take time to resolve, maybe months. Life cannot come to a standstill, but we should take all the necessary precautions and carry on with life.
We should be under no illusion that all will be well the moment the circuit breaker period ends or the number of infections comes down. COVID-19 is this generation's challenge. The virus is a tough enemy, invisible but formidable. It is now our turn to prove that we are worthy of our forebears and up to the challenge before us. And I have every confidence that we will prove more than equal to the task.
Unmuted.
Good afternoon and welcome to this afternoon's webinar. My name is Mark Winter and I am the CEO of InTechnology Distribution, and we are here today to talk about returning your staff back to the workplace safely with social distancing and contact tracing. I've played a few videos as a starting point, and the reason being is that today we actually have a substantial amount of people who are on the webinar or have registered and also on the webinar. And I really what we wanted to do was give people enough time to actually get online. And we're still seeing, I'm still seeing people come on now. Thank you, Julie. Welcome, Rob, Miguel, Michael, Caroline. Thank you. It's good to have you on the session. To give you an idea, we actually have over 300 plus attendees registered for this session, and it's cutting across 16 different countries. We've got 39 different industry segments, and the breakup of that is we've got organisations on the call today who have got 25 staff, and we have organisations that have got 45,000. So what we're going to try and do today is we're going to try and address everybody in a generic type scenario. But we want to try and make sure that we get across to all of you what we believe is the right thing for us to do as we're bringing our staff members and our teams back into the work environment. Obviously, because we are based in Australia, some of the content is going to be based in Australia. You would have seen one of the opening videos if you were on early. You would have seen that that's actually from Singapore, and we're going to talk a little bit about Singapore, and we're going to talk a little bit about other countries in the world and what other countries are doing to try and combat or try and address the issue of bringing their staff back into their corporations as we move past the coronavirus scenario. So let me do a little bit of an introduction in relation to us. So who are we? Who is InTechnology? We are one of the leading value-added distributors across the Asia Pacific region. We have been around for the last 21 years. We distribute technology specifically around the real-time location space, and that's actually tracking and monitoring where people are from inside an organisational perspective is concerned, for staff safety and asset tracking and things like that. We also do a lot of work in cyber security and also in wireless technology. One of our missions is really to help keep organisations safe and secure, and that's part of what we're going to talk about. Today. And I guess one of our biggest key motivations in our business is really we look for and we vet new technology vendors and new technology, and we only bring the best of breed to market. So I want to assure you that although what you're going to see today, this technology, the solution, the use case around this technology, yes, is relatively new. However, the location tracking technology that we've been representing has been around for at least 8 years that I've been working with personally. So, and what we've done is we've been able to take that existing tracking technology and utilize it and manipulate it and change it so that we can actually bring out this social distancing and contact tracing technology. You'll also see within the chat, there is a chat window, and you should be able to actually see the questions pane. If you do have any questions, feel free to ask. We did ask yesterday for people to put questions forward, and we have quite a substantial amount that we have already, put into the slide deck. Should there be any additional questions, we will actually, if we have time, we will definitely answer them live as we get to the end of the session. So let's look at why social distancing and contact tracing. Now, I've got a few people who have helped me out in putting this together, or helped us out in putting this together, and some of the content that you're going to see today comes from news outlets. It comes from whether it be Channel 9 or Channel 7. Some of it is also international. But we wanted to do that because the reality of what we're talking about now isn't our reality. When I say our, it's not in technology's reality. It's our reality as a human race. And we wanted to make sure that, we're not here, just talking to you about something that is fictitious. We wanted to talk to you about something and really get your heads across how do you bring people back in, and why do you need to bring people back into the organization in a safe way. So as I said, you'll see a few videos as we go through. Hopefully they come through clear enough. Hopefully the voice will come through clear. You may find that the video may lag a little bit depending on your internet connection, but hopefully it will be as clear as we can. So let's kick off. So the first thing is, what is social distancing and contact tracing? I want to go through a little bit of an intro in relation to that and why we need it.
Working from home could soon come to an end, with the Prime Minister pushing the premiers to relax restrictions to get employees back in the office. How it will happen will be discussed by the nation's leaders tomorrow, as New South Wales recorded just one new infection.
The Prime Minister believes there's no longer a reason for people to be working from home. Hand sanitiser, empty desks and space between staff, all part of the guidelines National Cabinet will look at tomorrow to allow businesses to order employees back to the office.
It's very important. We're working very hard to make sure that we restart Australia.
And it's interesting there, and I take note that the reporter actually said that employers are going to order staff back to the office, which I as a business owner, I don't necessarily take offence to it, but certainly as an employee, I think we need to be going back into the organisations knowing that we're going to be safe. The other thing also that I wanted to do is, I mentioned before, we're going to show a little bit about what's happening in different parts of the region. But this was another interview that our Prime Minister, the local Australian Prime Minister, did over the last couple of days that I thought was very relevant to our topic of conversation today.
We now need to get 1 million Australians back to work. That is the curve that we need to address. So to get Australians back to work, what is absolutely essential is that they can go back into a COVID-safe workplace. And this is something the Minister for Industrial Relations, the Attorney General and the COVID Commission, together with the unions and others, have been working on for some time. And already businesses are acting on this. It's not just about being able to go back into a workplace that is safe, but it is also about being able to do that confidently. And it's also about being able to go into a workplace where there are outbreaks. And let's not forget that when we move and start to ease some of these restrictions, of course you will see numbers increase in some areas. You will see outbreaks occur in other places. That's to be expected. What matters is how you deal with it and how you respond to it. And it's important that businesses, employees, employers have the tools to deal with the COVID environment and to ensure that they are all working together to support a COVID-safe workplace.
And it's interesting, you know, they talk a lot about the COVID-safe workplace, and we're going to sort of touch a little bit on that. One of the things that the Australian government and the Singaporean government has done a similar thing, and I'll touch on it in a moment. Excuse me. The Australian government has come out with a national COVID-19 safe workplace principles, and it's all supported by Safe Work Australia. And it's interesting as you read through the information, the information that they're providing. What we're starting to see happening within, from the government is really they're giving a lot more power back to the employee, back to the worker. And I would encourage you, and we'll send a copy of these slides to you, but I would certainly encourage you, for anybody who's on this session, certainly if you're from Australia, go to swa.gov.cms.gov.au, but have a look at the information that they're providing us as employers, us as in small businesses, and us as in workers. And based on your industry sector, you can click down on this left-hand side, and it will give you what the recommendations are from the employer, the small business, and also the worker scenario. But I want to highlight one piece in this. And one of the things that the government's basically saying is that it's saying to our staff, and which is all good, and I personally encourage it, that the staff members or the workers are entitled to elect a health and safety representative. If you wish to be represented by one, request for information of the Health Safety Committee. Cease unsafe work in certain circumstances. Now, to me, what this is doing is this is giving a lot more power back to the worker. And for some industry segments where, yes, they may have unions and so forth, this isn't what they're not talking specifically about unions. They're talking about the average general worker. Now, whether you come from a school, whether you come from a manufacturing plant, whether you're in a hospital, in hospitality, we all need to make sure that we're aware of what the government's expectations are, because our staff will be made aware of it. So, as I mentioned, this is obviously the Australian area. Singapore has a very similar thing, which is the National WSH Campaign 2000. And they also back that up with a taketimetoCare.sg. And again, for anybody who's in Asia or even in Australia, I would encourage you to take the time to actually have a look and see what governments are saying and what they're making or what they're recommending. Because what they do, as I mentioned before, is they're giving a lot more power back to our teams. And we need to make sure that as we go back into our environments, that we are providing a safe and secure environment for our staff. Now, there's a number of different reasons why, and we'll sort of touch on those as we go through the presentation this afternoon. And it'll become very evident when we start looking at what's the cost to our businesses if we don't provide this. And so, as I said, we'll go through that as we move forward. So we're here today to talk really around, social distancing and contact tracing, and what you can do to actually help when your organisations are going back to work, or what you can do to help your staff. And I wanted to give you an overview. Again, I've got some help with some of these videos, but I'd like to give you an overview in relation to what social distancing is. I know that we all potentially know it, but take note of, when we go through this next video, take note of how people are actually determining what a safe distance is.
So what's social distancing? Firstly, we should probably call it physical distancing. We don't want people to socially isolate. We don't want people to be socially separated from others, but we do want that physical distance between people. That means your arm span, 1.5 to 2 meters away from other people.
But unless you're 2 meters tall, it can be hard to know what that looks like without a measuring tape.
It's about 3 steps. So, 1, 2, 3. Enough space so that you can put a bed between you, or 2 shopping trolleys, or any of these people.
Or if you were holding a broom, you shouldn't be able to touch anyone with it. That's all fine in theory, but how does that look in the real world? In an office, you need to be about 4 desk chairs apart. And if you're still not sure whether you're keeping enough distance, then add a bit more, or see if you can hit them with a broom.
The reason why is because other people might be unwell, they might have minimal or virtually no symptoms, but still transmit coronavirus. So if you can keep that distance from other people, you're protecting yourself. And if you have minimal symptoms, you're protecting other people from being infected. If everyone can do that, we can change the course of this epidemic.
And it's interesting, I personally, I don't have the intention of actually purchasing all my staff members a 2-metre broom to bring in with them or a tape measure. So, you know, we're having to turn to technology. As the Prime Minister said earlier in the video, organisations need to look to turn to technology for what's going to help them in actually delivering, you know, a acceptable social distancing solution for their organisations. So now let's look at contact tracing. Contact tracing, again, we've heard a lot about it in the media. Contact tracing in an open environment or in a public environment is a very expensive thing to do. We're making that a lot easier within the corporate environment, but let's just talk through and go through exactly what we see as contact tracing.
To try and stop the virus in its tracks, many places around the world have implemented physical distancing. But another tool that could fight the spread is contact tracing. So, what is contact tracing? How effective is it? And how do we implement it? This probably isn't going to blow anyone's mind, but contact tracing is literally tracing all the people who have been in contact with an infected person. It's the public health equivalent of detective work. Sometimes it's straightforward, but oftentimes contact tracing is not so simple. People typically don't keep detailed logs of everyone they've been near all the time, and our memories are imperfect. Even after sorting through calendars and social media posts, contacts can slip through the cracks. The good news is that a contact tracer doesn't have to catch every potential new case to be effective. One epidemiologist estimated that getting 85% of contacts to self-quarantine would slow transmission significantly. Still, leveraging technology could help contact tracers cast a bigger net. Until then, places without this tech will have to do it the old-fashioned way. Manual contact tracing is not something that can be applied in every stage of this pandemic, which is why I am coming to you pre-recorded live from my apartment. But someday, public life will resume. I will leave this apartment again. And as we readjust to life on the outside, contact tracers will likely play a key part in making sure the virus doesn't spread out of control again.
So as we mentioned, I mean, that's the scenario, obviously, and that's what that basically is, a very high-level overview in relation to what is social distancing and what is contact tracing, excuse me. And we wanted to look at, so what's the cost of not doing anything? So if we're an organisation and we believe that we can go back to work and we can bring our staff back in without actually giving any protection at all, what potentially is the cost, or what is the cost of us not actually looking at implementing anything within our organisations? So let's have a look at what that might be.
Rabbitohs superstar Latrell Mitchell is at the centre of a coronavirus scare on the day teams began preparing for the NRL's reboot. Nine's Danny Weidler joins me from NRL HQ with the breaking news. Danny, what can you tell us?
Well, good evening, Pete. Just a few days after Latrell Mitchell was fined $20,000 for his isolation and social distancing breaching, he had to turn up at South Sydney's HQ today with all the South Sydney side to learn about the COVID-19 protocols for the NRL players. Obviously, part of that was being tested by the South Sydney doctor. He presented with some cold-like symptoms. As a result, he was sent straight for testing for COVID-19 and sent straight home. Now, Wayne Bennett has said, look, in a normal circumstance, you might not have noticed his symptoms, but these are not normal times, so he had to be sent away. And Pete, so did 3 other South Sydney players.
Of the 5,500 tests done in 24 hours, a 7-year-old boy from Warragamba Public School was found with the virus. The school closed, now undergoing a deep clean. Small outbreaks like this will become a consequence of easing restrictions.
I anticipate it will happen more frequently.
Universities want in on the relaxation action too, chasing a timeline for when international students can re-enter the country.
We're certainly very keen to see international education vibrantly underway again. Just in the context alone of Sydney, it is worth billions of dollars a year.
The number of coronavirus infections in Victoria has jumped by more than 20 cases, the majority linked to a Brooklyn meat processing plant. Reid Butler's there. Reid, what's the company said?
Pete, I've spoken to a representative from Cedar Meats today, and they say the company first became aware that an employee had tested positive for COVID-19 on Monday last week. Since then, we know that infections linked to the facility have skyrocketed, yet the public has been kept in the dark. Now linked to more than 30 infections, this abattoir is at the centre of one of the biggest coronavirus clusters Victoria has seen. There were 22 new cases recorded in the past 24 hours, bringing the state's total to just over 1,400. 19 of the new infections are linked to the Cedar Meats facility, 34 cases now associated with that cluster. The company first became aware an employee had tested positive a week ago. 4 other staff members were found to have contracted the virus on Wednesday. By Friday, all 350 of the facility's staff had been tested.
So a little bit of an update on that. I think this news bulletin was actually out about 3 days ago, and today they came out and said that now 45 of their staff have actually tested positive. So this is a classic example that we'll talk about when it comes to what is the cost of not doing anything. So if we look at the NRL. So for those that are overseas, and there are quite a lot of you overseas, NRL is our National Rugby League competition, and they've been trying to push to move back or start the competition again. And the first thing that they did is they got all the teams, teams separately to go to their specific clubs, and they were going to run through what the whole COVID-19 process was for them to actually potentially start back. And start playing again. The classic example in that situation is that they actually had one player who they already knew had broken the social distancing laws the weekend before, but they brought them into the club, allowed them to mingle and mix with the other players in the club, that now potentially has not only closed or stopped that club from being able to go and play if the competition does start, because remembering that when somebody has potentially got the coronavirus, they need to go into a 14-day quarantine. So the potential is that everybody within that club needs to go into a 14-day quarantine, which means that, one, they either don't start the competition as a whole, in other words, all 14 clubs or 15 clubs, however many there are, the competition as a whole doesn't start, or alternatively, that particular club has to sit out the first 2 weeks because they can't be involved in it because they had one case. So the cost of that in that type of situation is potentially millions of dollars. So if the NRL can't start and they have to push the start back by another 2 weeks, we're talking, as I said, millions of dollars for that cost. As you would have heard, the gentleman from the Sydney University said that international education is actually worth billions of dollars alone in Sydney alone. So if you work that back, if you're saying billions of dollars, I did a rough calculation as that video was on. It's about $19.2 million a week for each week that they're not able to go back. And you saw the video also in there where it was talking about the school student who went back to school and happened to be positive for coronavirus. So they ended up having to close down the whole school. If you have a scenario or a solution that you're actually able to determine, as an example, who that child came in contact with, or who that football player came in contact with, and you were able to isolate just those people, just those other football players, or just those other students that student came in contact with, the potential is that you don't have to close down the National Rugby League from reopening. You don't have to close down the school again, and you don't have to keep the universities closed. In the situation where we're talking about the school, we can't put a value on that. I wasn't able to put a value on that, I should say. And the reason being is because we're not just impacting the students and the teachers that aren't able to go back to school. We're not just talking about the cost it is going to be to actually re-clean the school. We're talking about the cost to business that you've got 300 or 600 students' parents who had planned on going back to work, who then weren't able to go back to work because of this potential outbreak. So the cost of not being able to maintain and manage social distancing within the organisation or environment that you're in, and without the ability to actually do contact tracing, as I said, is costing millions. And let's use one more example. I feel very sorry for the managing directors, the owners of the abattoir, but look, I really wanted to use them as an example because it's a classic example in relation to how contact tracing and social distancing can actually help in saving money. But let's look at what the cost is to this particular organisation. Now, we've put together a slide here that's got some numbers on it. So we're looking at, this is an annual salary. And I guess as we're thinking about this, or we're talking about this, think about this from your own corporate perspective, from your own company perspective. So if you're in a school environment or if you're in a healthcare environment, what's the average salary that you might look at? So we sort of looked at that. Let's say, for instance, the annual salary, which is in this column here. This is the annual salary. This is the daily salary. So we've taken the annual salary and we've divided by 252 working days of the year, which gives us what it costs them per week for an employee who's getting paid $45,000. For that organisation to shut down, it's going to cost them $893 for 5 days for one employee. Now, they said they had 350 staff. They've got 45 staff now that have come across with the coronavirus. So they can't obviously come to work. But that's going to leave roughly 300 staff. Now, if you have to close down a manufacturing plant or part of a facility or a whole facility because you actually have people who have got coronavirus and you weren't able to determine and contact trace who they'd been in contact with, the cost alone, just in wages for that organisation, in this situation, and we're going to be really conservative, let's say it's that they're all on $45,000 a year. It's going to cost them $267,857 a week. A week for those 300 staff. So over $250,000 a week to actually have that business closed. Not only that, but let's then look at what's the actual. What we're not doing is we're not calculating any loss of revenue that the company is not receiving by being closed. So we sort of said, let's do a rough number. Now, I don't work in the meat in the abattoir industry, so I don't know whether these numbers are exact or not. But let's hypothetically say that it's 5 times their revenue would be 5 times what their wage cost would be. So for 1 week of being closed, you're talking about $1.3 million in potential lost revenue, plus the $267,000. So roughly $1.5 million per week. It's actually costing this business because they actually had to close down the whole entire plant. If they actually had a contact tracing technology in place, what they would be able to do is they would be able to identify those 30 staff members that had coronavirus or tested positive to coronavirus. They would then be able to actually look to see who did they come in contact with, and then they would be able to isolate those other team members, other staff members. So the example might be, by the sound of it, those 30 people who were originally infected obviously had mingled with another 15 from the organisation, and they've obviously contracted it as well. But let's say they have 350 staff there. Let's say we took off 50 staff. That still leaves 300 staff that can continue to work because we know that they are safe and we know that they did not come in contact with those people that actually had coronavirus. So again, it's a difference between being able to actually continue operations or having to close down operations. Although you might have to close down certain areas, so you might have one division that might have to close, but the rest of the organisation could then continue. But we wanted to give you that and give you an idea in relation to what is the cost to the business by not doing something. So now what I wanted to do is to sort of basically go in and do an introduction in relation to what our social distancing technology is and how it works. So how does it work? It's pretty simple. Basically, you have a tag, which is what you can see here. We have 3 different types of tags. You have one that sits on your wrist, one that and then there's 2 different types that might sit on your key ring or your keychain. They're Bluetooth low energy. The BLE is what we call them, Bluetooth low energy. And when one tag comes in contact within 6 feet or 2 meters of another person, the tag will actually it will make a chirping sound that will notify both employees that they've come too close to each other, which then allows them to go, okay, sorry, and then they can move away. So it's allowing them to keep that distance from each other, and we're notifying them when they come in or when they come too close in contact with another employee. My concept behind this is it's much better to do that than have somebody, as we saw in an earlier video, which I thought was quite funny, where there was a lady who was, had 2 shopping trolleys in between them, or a bed, or a broomstick. This technology, as I said, as people come closer together, it will let out a chirp. They know that they're actually getting too close. Let's talk a little bit about what are the solution components. And it's a very, very simple topology and simple type of deployment. I mentioned before, there's literally only the tags that are required to actually put on or for someone to actually have on their body or on themselves that will allow us to determine where that is. So the requirements for this is really our BLE tags, which is what you see here. The tags communicate with each other via Bluetooth, low energy. And as I mentioned, it will tell you whether you're too close to somebody or not. My personal opinion, and I had a session with a team this morning, and my personal opinion with this technology, I know within my organisation, we have everybody wearing the wristband, and the reason being, and let me give you a bit of detail in relation to why. If I have this on a key ring, as an example, I typically leave my keys at my desk. If I get up and I go to the bathroom or I go to talk to somebody, I don't typically carry my keys with me. However, as I sit in the office now, if I could turn my video on, you would see I have a blue band tag on me, and I have my Apple Watch on the other arm. I don't necessarily notice it. It's just there. I take it off when I get home, and I put it on, and I bring it back into the office again. So as I said, it's a very, very simple type, very, very easy type standalone solution. If we look at the contact tracing piece, so the contact tracing piece goes one little bit further. So it still has the Bluetooth low energy wristband tags or pendant tags or key fob, as we mentioned before. It still is on the lookout for another tag that comes within 2 meters or 6 feet. It still will do the same thing. If they do come in close contact, then it will actually chirp and notify both employees that they're too close. The major difference that we do when we talk about the contact tracing piece is we add 1 extra or 2 extra elements to it. So the extra elements is that when you do come in close contact with somebody else, we will actually then keep that data. We will log that contact as an incident or an event, and then we push that data to our cloud server, our enterprise cloud server that sits in the Amazon cloud. And I'll talk a little bit about on the next slide exactly how the solution works, which will give you a little bit more of an idea. So let's look at the solution components. So I mentioned before, you have your BLE tags, so your Bluetooth low energy tags. The tags, basically they have a 12-month battery cycle, and the batteries can be changed on site. We'll talk a little bit more about that in a minute as well. But we have the Bluetooth tags, which is what you see down here. You have the Bluetooth low energy beacons. So the tags talk to the beacons. So when somebody comes in contact with somebody else, the information on the tag will be passed to the beacons, and the beacons basically, they get plugged into a power point within your infrastructure. The beacons will then be connected to your existing Wi-Fi network. And if you don't have an existing Wi-Fi network, it's something we can obviously talk to you about. I mentioned before that we do a lot of work in the Wi-Fi space. And then once that information gets onto your Wi-Fi network, it then gets pushed up into our cloud portal through your Wi-Fi, what we call backhaul. So in other words, we talk Bluetooth low energy from the tag to the beacon, and then we talk Wi-Fi from the beacon to your network, and then it gets pushed up into the cloud. The information gets pushed up into the cloud, and that's where you're then able to actually go and we can look at all the information in relation to who's been in contact with who, and I'll talk a little bit more about that in a moment. And I do apologize, I did actually have these slides out of order, but I'm going to cover this anyway. Why would we use Bluetooth low energy? I can tell you why we use it, and one of the main reasons is it is the latest technology. It is the most cost-effective technology when we talk about location information or location technology. Traditionally and previously, for the last 8 years, a lot of organizations, a lot of you who are on the call right now, I've actually, in actual fact, we're getting lots of questions, and I appreciate that. Keep them coming. We'll try and get to most of all of them before the end of the session. If not, we will certainly answer them and send them out. Most of the organizations that we've dealt with over the last 8 or 9 years have actually typically been working, and the location information we typically use for asset tracking and things like that has typically been on a Wi-Fi network. which has been great because that's what we've all known, and that was the latest and greatest technology. But BLE has certainly come to its own, and really now most people use BLE every day as they get in their phone when they connect their phone to their car or they connect their speaker to their phone. If you're not 100% sure what BLE is or how it works, go and ask a 12-year-old, because I can guarantee you that they're connecting something to their phone or something to BLE. So I mentioned before, it is the latest technology. It is now become more advanced technology. It is the most cost-effective. We have a very long battery life, around about 12 months on the actual tag itself. When there is a contact, in other words, when somebody comes in contact with another person, that contact information, in other words, tag A and tag B is in contact and it gets passed up to the cloud, that actually gets stored on the tag and then talks back to the beacon when it comes in range of a beacon. So you don't have to have 5,000 beacons out there. We have organizations right now we're talking to that have 1,500 employees across a warehouse environment. In actual fact, let me use one that I was talking to this morning. Somebody who has 1,500 employees, they have 3 floors of a building, and they said, how many BLE beacons do we need? And I said, well, how many lifts do you have? And how many bathrooms do you have on every floor? And they said, well, we've got 4 lifts on each floor. That's, we've got 3 floors. That's 12 beacons. Plus, we're also going to put them out in front of the kitchen, and we're also going to put them out the front of the bathroom, because they're the most traversed paths that their staff will go through during the course of the day. The other part also with BLE is that there is a button that's on the front of the tag. So you may decide to program that button to, if I feel sick, I'm going to push that button, and then it's going to send an alert to the system to say, hey, I'm not well. Maybe we might want to actually see, I might go and get tested. Or like I said, it can be programmed for whatever it is that you want to program it for. The other thing also with the BLE and the BLE tags is that we can also program the tags what we call OTA, which is over the air. In other words, you don't have to physically connect the tag to something to actually configure it, which makes it a lot easier and a lot faster to deploy and a lot easier to manage. And the other part to it is that it's a replaceable battery. So it's very similar to a watch battery. So at the end of the 12 months, or when you get notified that the battery is running low, then you can basically go and buy a replacement battery and put that battery in, and the tag will continue to monitor. Now, I did want to talk about the cloud portal because it is very important, and keep those questions going. Excuse me. So the cloud portal. The cloud portal is only used for contact tracing only. So if you remember when we talked about social distancing, the 2 tags come together and it will chirp. So we don't need, and that's a standalone solution. You don't need the cloud portal for this. But the cloud portal comes in when we're talking about doing the contact tracing piece. So again, the cloud portal, when we have it for contact tracing, it's used for tag management and configuration. We set up workflows and events and reporting. So if somebody does have coronavirus and we want to actually find out who were the people that were around them, then we can actually go in and we can look at the reports and we can pull those reports out. The alerts and events are done in real time, so we can see it in real time online, the over-the-air management of the tags we said before. The contact tracing is also done anonymously. So let me give you an example. In the configuration that we have at the moment, and I know it's very small and I do apologize, but let me talk through this. What we've done on this screen here is we've actually done a search for Patrick. Now, in our environment, we've made the decision that we're okay to actually have first names of people attached to a tag. In some organizations, they don't want that. In some organizations, they just want to use the MAC address, which is the unique identifier of the tag, and they will actually tie that tag to a staff ID. So we're not actually tying it to a physical person, although it is tied to a physical person because the staff ID number is relevant to that particular person. But when you view it, you may not want, for privacy reasons, you may not want to show that. Now, in our environment, we're okay to show that because we all know each other. We're only a small organization. So what I can tell you is that we've done a search here and we've seen that Patrick has actually come in contact with Mark, he's come in contact with Dietrich, and he's come in contact with Bob, and they've been in contact with each other for 1,892 seconds, which basically tells us that these 3 guys or 4 guys actually had a 30-minute meeting. So it actually gives us an indication that if Patrick as an example, or Bob or Mark or Dietrich, if any of those guys actually did have coronavirus, we're able to go back and see who were the people that this particular user had spent most time with. And we can see that in a graphical representation here as well. So this middle piece here is the user. This might be tag number 1, 2, 3, and it might be allocated to me, which is Mark. You can see that Bob, Dietrich, and Patrick were in contact with me for a certain period of time. And it may very well be that you may want to go and say, well, okay, guys, we've seen that you've come in contact with these. We would like you to now go and self-quarantine because we're concerned, or at least go and get tested, because we're concerned that you may have contracted it because Mark has actually got COVID-19. The other part to it is that it also provides a historical contact as well. So if you want to be able to go back and look, let's say, for instance, I've been fine. I felt great for the last 10 days, but all of a sudden on day 11, I start feeling unwell. Now, I want to go back to the last 2 weeks and see who I've come in contact with. Again, we've got that information that you can actually pull out of the system as well. So it's very, very detailed and very, very granular. Now, we've got lots of questions, and we are going to go through the questions that we've already received, and we hopefully will get through them. We've got about 13 minutes, so hopefully we can get through these questions. Please feel free. We've got a bunch of questions that are still coming through, and we will answer them as we move forward. So let's get to the first one. What is the difference between social distancing and contact tracing? So as I mentioned before, and we will cover this again, and I think it's important because these are questions that we have been asked. Social distancing helps people maintain 2 meters of separation or 6 feet of separation with an alert if you come closer than that distance. The tag automatically identifies to each of the users or each of the people wearing the tags that you've come too close. So remember what I spoke about earlier, where the tag will actually chirp. So you know when you come too close, it'll beep and you'll move away from each other. The contact tracing piece goes one step further, and it records the history of those contacts in a database. So that was what we talked about before. It sends that information up to the cloud. And the tags rely on contacts on their contact to then be pushed to the cloud network, as I just mentioned, or the cloud software, as I mentioned. Can social distancing be purchased separately from contact tracing? Absolutely. The tags can be purchased and used for alerts for social distancing. The additional piece, and we've got organisations that basically have said, Mark, we want to start somewhere. We'd like to start with just social distancing. That's great. Let's start at that point, and then if you want to go and do contact tracing further down the track, you certainly can. And as we said here, contact tracing requires the use of the software platform. And I think I've mentioned that quite a few times in the last sort of few minutes. So we'll keep on going. How does a tag communicate with the cloud platform? To speed the deployment and to keep the cost down, the tag, as I mentioned earlier, the tag will communicate to the BLE beacon. As I said, it's a wall plug that gets plugged into a power socket. And then we use your existing Wi-Fi network to push the data across. And that information then gets pushed to the enterprise cloud platform. And the other thing also for those organizations, and I know there's quite a few of you because I've had about 4 or 5 questions as I've been talking about, can we use our existing access points that have Bluetooth Low Energy built in? Absolutely. So if you already have access points that have BLE or Bluetooth Low Energy built in, you don't need to use our BLE beacons. So again, talk to me, talk to our team, talk to Mary. We'll be able to help you and make the most or the best recommendation. What is a Bluetooth Low Energy Wi-Fi gateway? So our gateway is a small device I just mentioned. It plugs into an AC outlet that allows us to communicate with your Wi-Fi network. So I hope that's clear. Is the location of the tag tracked? No, absolutely not. In actual fact, that's one of the things that that we don't do. It's unlike the traditional RTLS solution. So I mentioned earlier, we do a lot of work in tracking assets, people, and things around factories, around hospitals, and so forth. But this particular solution does not do any location tracking at all. It only monitors the proximity of the tag to each other. And as I mentioned earlier, the proximity detection, it's a feature of BLE that works with a tag relationship rather than a location relationship. And that's where we're saying here, rather than determining an X and a Y coordinate. An X and a Y coordinate is a location coordinate. How does the tag know other tags is within 2 meters? So within the tag itself, the BLE basically beacons, so it has an outbound signal, but it scans and listens at the same time. So if I come too close to somebody else, it will get a strong signal and it will then notify both tags. So we talk about the dB threshold, which is a technical term, but when the dB threshold representing 6 feet is met, we will alert the individuals and record the ID. So when we are talking about contact tracing, when someone, as I mentioned before, when someone does come within the vicinity of another tag within 6 feet or within 2 meters, we will capture that information and push it up to the cloud with contact tracing. Again, I'm going to reiterate, with social distancing, we don't. We just alert the tags to say move away. This is a really great question. So in actual fact, let me thank Andrew for this one. Does the position of the tag on your body affect accuracy? Absolutely. So radio frequency or RF signal is affected when passing through water, and because we're made up of 60% water, it will impede the signal, and it's going to depend on where you actually have the tag. So me personally, I mentioned before, I have a tag that's on my wrist. All our employees within our organisation, they're all worn on the wrist. And the reason being is for a number, sorry, I shouldn't say that. I should say either wrist or chest, so a necklace. And the reason being 2 reasons. I mentioned before, I don't always carry my keys. So by having a tag that's actually on a key, or I slip into my pocket, quite often I'll take things out of my pocket and I'll leave them. If it's on my wrist or it's around my neck, I keep it with me all the time. There is no difference in price in relation to the tags, so they are the same price. But as I said, it's important that for me, it's important that we have the tags on everywhere, because as I may have mentioned earlier, I don't want to walk to the bathroom and pass somebody in the bathroom who doesn't have their tag on, especially if I find out later that they've actually got coronavirus. So, we within our corporate policy is that we have a wristband tag, or we have it around our neck. And the other part to it is that we want to make sure that, I personally want to make sure that I can see that someone's wearing it, because if I can't see it, then I'm going to walk away from them, just to protect myself. I am going to jump into one question that's a live question. I know we've got about 7 minutes, but I'm going to jump into a live question because it's a very good one and very valid. The question is, I'm very self-conscious when it comes to colors. Does the tag come in multiple colors? It does. So, and typically the reason that the colors of the tags are bright, and in my personal opinion, is I'd love them to be fluoro, and so that I can actually see that when I'm talking to somebody or when I'm coming in contact with somebody, that I can see that they've got a tag on, as I mentioned before. I want to make sure that I'm being protected, and I want to make sure that they're protected at the same time. How is the solution priced? So for social distancing, you only require the tag, so it's just a tag cost. When it comes to the contact tracing, you will require the tags, the BLE proximity sensors, and the Cloud Enterprise platform. And we'll talk a little bit about, and we've got a website that you can go to if you're looking at, if you are looking at getting pricing. There's a dedicated website that I believe should be up by now. If not, I'll give you the details. I'm pretty sure it is. I've got a great question here, but it's a live one I'm going to take. How about if we have guests visit the office? What's your plan for tracing? An excellent question. So not dissimilar to what we see now in most warehouses, in most hospitals, in most aged care facilities in particular, and certainly in an office environment. I know whenever I've been into one of these type of environments, I get some type of tag. Whether it be it's a badge, or whether it be something that I need to then bring back to reception so that they know where I've been and know where I've gone. Again, that tag gets allocated to a person. Typically, you will actually sign in and out of a warehouse, or you'll sign in and out in a visitor's book. So when you've done that, you then have the ability to actually trace back to that person. Obviously, they need to be sanitized, so you'd need to spray them down and wipe them, which is fine to do. But yes, absolutely. So the tags can be reused, and you can certainly have a solution for managing guests and visitors when they come to the office. That's a really good question, and thank you for that. So we've got a little bit of time for some more questions. So let's go back. What are the costs? As I mentioned, we can get through that. Does the blue tag come with some kind of pulse monitoring? No. So we don't determine whether the tag is actually on or off the person. We're basically, as I said, and it's interesting, I know in our environment here, as I mentioned, if I see somebody in the office that doesn't have a tag on, I'll just walk away from them. And certainly as we're moving forward, I can see this happening more and more often in organizations that, if you walk into a meeting, again, that's why I personally, I want to be able to see that someone's got their tag on. I don't want to have, to be able to say, I don't want to have to say to somebody, if I'm going into a meeting and they're wearing a long sleeve shirt, by the way, can you just roll your sleeves up so I can check to make sure that I'm protected? But it is very important. Whether it be, as I said, whether it be something around the neck or whether it be something around the wrist. I'm not a big fan of a key type scenario. Excuse me. Does the BLE tag interact with other BLE we have installed in the office for other purposes? No, it definitely won't. Although it can be configured to work with it. So depending upon what it is you have, love to take that offline and have a discussion. Let's go through and answer some more. Does the level of clothing over the wrist affect the tag? No, in actual fact, it doesn't, Kathleen, and thank you very much for that question. The tags are splash proof. I certainly wouldn't be dipping my hands in water. They do actually have open pieces, but I've had mine for quite a while and I haven't done any damage to it. I take it everywhere I go. Another great question from Carlo, really good. Are wireless site surveys required? Absolutely not. And that's the other really, really good thing about using BLE is because we're not doing any location, all we're actually doing is we're doing distancing and we're doing contact tracing. There's absolutely no requirement for anything other. There's no additional services requirement. One of the things that we're looking at putting together is literally we will sell you 100 tags, 1,500 tags, 5,000 tags. It will come in a box. It will come with instructions. It will come with BLE proximity sensors and a login for the enterprise cloud server, and you will be able to deploy it within a day. It's really, really important that this solution, and hats off to Aristaflow. They've done an amazing job with pulling this together because it's very, very important that this type of technology really can roll out in a very, very short period of time. Do the tags have a low battery alarm on the cloud? Absolutely. You can certainly see the battery life of the tags. How about notification alerts from the portal? Is this available in the features? Say administrator wants to alert. There is some. Yeah, look, the question basically is, can we get alerts, or I'm going to summarize it. Are there alerts, and can we see whether people are violating? Absolutely. Would you actually use that information directly? I don't believe so, but again, happy to have that conversation. If you see that somebody is actually violating social distance laws, what I can tell you is that when the tag chirps, the last thing you want to do is stay close to it because it chirps. It's annoying. It's like a truck reversing, the beep, beep, beep thing. So yeah, typically you won't want to necessarily stay around if someone is in close proximity. So look, there's a lot more questions. I do apologize that we're not going to be able to get to them. We are at 59 minutes and 37 seconds. There are a couple of things I wanted to touch on as well. I had a really big question, a really big conversation this morning about what Apple and Google are doing. For all of those you that are interested, Apple and Google have actually put together a solution where they will upgrade the firmware of your phone, and you will have the ability to actually to activate social distancing and contact tracing using your mobile phone. Again, as I mentioned before, what if your users are using it internally, or you're using it internally, and your users leave their phone at their desk? My example was, if I go to the bathroom, I don't take it to the toilet with me. If I go out for lunch, I typically don't take it with me. If I go into a meeting room, I typically don't take it with me. Now, if I go to a meeting room, I want to see that everybody's got their tag on. That's a priority for me. The other part too, look, and don't get me wrong, I totally, from a personal perspective, I will certainly be supporting what Apple and Google are doing, and I will actually have and potentially use that myself from a personal perspective. But certainly when I'm talking about a corporate situation, we don't have control over it. We don't have any control or management over it. As I mentioned before, you can't manage, you can't monitor and manage what you don't own. What if someone reports? This is the other really interesting thing. I was listening to a podcast. Sorry, I was watching a BBC video this morning as I was preparing for this, or doing the finalisation of preparing for it, and it was about the NHS in the UK. The NHS have said we will support Apple and Google's initiative, but we will not be using it internally. We will not be recommending it, and the reason being is because what if somebody, let's say that I've got it on my phone, and I decide to maliciously say that I'm ill. Now let me use an example. Let me use the abattoir example, right? So I'm one of the 45 people who have actually been quarantined, but I'm not one of the 45 that have been quarantined. I'm one that didn't come in contact with, and I'm like, bugger that. These guys are getting time off work and they're getting paid for it. I'm going to say I have coronavirus. So they're actually using the technology with malicious intent. And then what will happen is that anybody who was in contact with that person that said, I think I have symptoms of coronavirus, then all of a sudden they get notification saying, hey, you've come in contact with Mark. He's just told us that he thinks you might have coronavirus. It will broadcast a message out to all of those users. And all of a sudden you've got not 45 people who are actually self-quarantining. You've actually now got 100 or 200 people who are self-quarantining. So, I implore you to have a look at, do an NHS, Apple and Google search. And it will actually, it's about a 15-minute video. I didn't want to show it during this because obviously we didn't have a lot of time, but have a look at it. Very, very valuable to have a view of somebody else. Like I said, I think it's a good idea personally. It's great from a personal perspective, not really something that I would recommend from a corporate scenario. The other interesting thing, as I was preparing for this, I mentioned before that we do a lot of work in the cybersecurity space, and one of the vendors that we work with is a company called Living Security. They do security awareness training, and they do a cyber escape room and a virtual cyber escape room to educate staff on cyber security. And so I was actually doing, amongst other things, obviously I have more than one thing I do within the organization, but I was having a look at their website yesterday, and I came across this video, and I went, this is fantastic. And what they're talking about a little bit about what Apple and Google are doing, some of the reasons, some of the security concerns, and I was compelled to actually include it. So this is about a minute, but I really felt compelled to show this to you. I've only got a couple of slides after this, so if you can bear with me. If there are any other questions, I'm happy to take them as well. But let me just play this for a minute. I just think it's valuable for you to know this information whilst you're with us today. So let me just play this real quick.
What's up, guys? My name's Dan Schoonmaker, and most people around here, they just call me Schoon. I'm a software engineer at Living Security, and today I want to talk to you about contact tracing. After weeks of hibernation, I'm as excited as you are to reopen society, maybe shave a little, and get back to real life. Unfortunately, we all know things are going to be different, so I wanted to figure out exactly how different and let our team know what's up. One thing I discovered is that authorities around the world are considering the use of something called contact tracing to help reopen society safely and successfully. It's actually not too complicated. Basically, instead of tracking down all relatives, neighbors, contacts, and dog watchers of someone diagnosed with coronavirus, your smartphone would do it for you. Being the nerd that I am, I wanted to dig in and see exactly how this technology would work. The way Apple and Google are proposing, an app or operating system update would allow you to opt in to Bluetooth low energy technology in your settings to share an anonymous key with nearby smartphones. The idea is that if one person tests positive for the coronavirus, that person's key would be flagged and then alert all other keys it comes into contact with, so people can then begin self-isolating, stop spreading, and seek care. If everyone with smartphones participates, it's like a COVID tracking machine. If not, it's way less effective. So in theory, your key is anonymous. Nearby key matching is done on your device, and your phone is not sharing your location data. But my concerns are that authorities will likely want to track location and other private information too, to better analyze virus hotspots and its spread. And access to that database could then be leaked or breached. There's also fears about social control. In some countries like China, contact tracing means sending location updates to the police, storing your temperature data, and scanning your face or a QR code to make sure you have the green light to even use public transportation or check into your own home. Sound like science fiction? I promise you it's not. We feel really passionate about getting the word out and opening up a discussion about contact tracing here and now. Should we participate? Is our privacy being taken seriously? Is this a saving grace or a liability? My point is, we must ensure this crisis doesn't lead authorities to normalize privacy infringement.
So my humble recommendation is that we don't just outsource our brains, but we really think about our security and privacy before taking someone's word for it. Let's make sure authorities collect only what they need and hold them accountable to widely accepted privacy regulations like GDPR
and UN declarations. The onus is on the authorities to justify contact tracing, address security and privacy concerns, and phase out tracing when it's no longer necessary. When the onus is on us to make that decision as an informed public. I know I speak for Living Security when I say we'd like to fight with you
against COVID-19 and for privacy. As always,
stay safe and secure. Let's fight for health and privacy together.
So as I said, it's important that we are all informed and we all know, exactly what's going on and the potential. Couple more live questions. Let me just have a quick look. We've done the tags, we've done the batteries. Look, in actual fact, there's about another 30 or 40 questions and I'm struggling to get through them, and lots of the ones that I'm reading at the moment are quite long, which is fine. What we'll do is we will answer these post the session today. This session actually has been recorded, so we will send you a copy of the recording, and please, we encourage you to pass it on to people within your organization that you feel need to hear this. We feel that you feel, are people that really do and should really understand what this all means. Next steps. So let's look at what the next steps are. So we will, if it's not already up, it will be up tomorrow morning. We actually have a site that we actually have that we've put together, which is actually for pricing. So the things that you will need to provide to us, obviously your details, so, contact details and so forth. What the solution is you're looking for, we'll have a drop-down box that says social distancing, contact tracing, or both. We need to know the number of employees, obviously pretty important for us to get pricing back to you. Most importantly is the time frame for your teams returning to work. Now, if they've already returned to work, that's fine. We understand that. If they're already at work, that's fine as well. We understand that as well. The reason that we need to know that is because we've had an absolutely massive demand for this technology. And one of the things that we're trying to work with the vendor is to ensure that we actually have enough product to supply or to keep up with supply. So look, it might be a little bit presumptuous of us, but look, the reality of it is, if you're looking to go back to work in 2 weeks or in next week or in a month, please let us know. It just gives us an indication in relation to what our stock levels need to be, because as I said, this is a hot topic, and there's lots and lots of inquiries around it. There's lots and lots of companies who are deploying it. The sooner that we can get those timeframes and the rest of the details is going to help us. Thank you again, everybody. I really appreciate it. We really appreciate all the questions. Hopefully this has been informative. Hopefully this has given you enough information that you can take back into your organization and ensure that your organization keeps your staff safe upon return post this coronavirus. And please, from my family to yours, stay safe. And again, thank you very much for your time, and we look forward to talking to you again shortly. All the best and enjoy the rest of your afternoon or evening, depending upon where you are. Thanks again.